So welcome everyone to the Bullet Points Lunchtime webinar series on firearm injury prevention for clinicians. I'm Dr. Amy Barnhorst, and I'll be the moderator for today's session. And we're really excited that Robin Cogan is here to discuss the impact of firearm violence and threats on student health from the perspective of a school nurse. So a few announcements. We will have more webinars coming up on the third Tuesday of the month at noon Pacific, where we have a quick 30 minutes. You can sit and eat your lunch and listen and learn about firearm injury prevention. And we'll also have a poll at the beginning of each webinar and at the end. They're really quick, and it helps us understand where our audience is coming from and what you know already and what you would like to learn from our webinars. We'll launch the opening poll right now for everybody to go through. It'll take a minute or so, and then I will introduce our panelists. Okay, thanks to everybody for completing that. And just a reminder to use the Q&A function for questions that Robin will have a chance to answer at the end. And I'll kind of go through them and present some of the questions. And without further delay, I'd like to introduce Robin Cogan. She is a nationally certified school nurse, currently in her 22nd year as a New Jersey school nurse in the Camden City School District. Robin's the New Jersey State School Nurse Association Director to the National Association of School Nurses. She's proud to be a Johnson & Johnson School Health Leadership Fellow and past program mentor. Robin is the honored recipient of multiple awards for her work in school nursing and population health. She serves as the faculty in the School Nurse Certificate Program at Rutgers University Camden School of Nursing, and she writes a popular blog called The Relentless School Nurse. Her extensive work in school nursing was included as a case study in the National Academies of Medicine Future Nursing 2030 report. Robin also writes a monthly column in My American Nurse, the official journal of the American Nurses Association. And with that, I will hand it over to Robin. Thanks for being here, Robin.
Thank you so much for inviting me and for giving voice to the perspective of school nurses on this really important topic. And so I'm going to get started. I hope everyone can see my screen. I think so. So school nurses work at the intersection of health and education with the focus on fostering the health and safety of children. We understand that we must provide physically and emotionally safe school environments for our students to learn and to flourish. When we use our voices, we can drive policy system changes and practices. And truthfully, that's why I speak out. I speak out on behalf of students, families, and school communities. Every day, 95,000 school nurses enter our nation's schools prepared and ready to serve more than 56 million children. For 7 hours each day and more with before and after school, more than 185 days a year, families and school districts and communities entrust their children to school environments with the expectation, and rightfully so, that they will be kept safe from harm. School nurses are healthcare providers at the front lines of gun violence, COVID, anything that's coming into a school, charged with responsibility of protecting students and faculty and fostering school environments as safe places to learn. But did you know that 25% of schools across this country have no school nurse at all? 35% only have part-time coverage. That's 60% of all schools. The remaining 40% of schools may have a full-time school nurse, but our ratios are astronomical in some areas, an unsafe and untenable practice. So firearms are now the #1 leading cause of death for children. Let me just remove, hopefully you guys can remove that. Sorry about that. And that happened only since 2020. Actually, though, firearm injury has been the leading cause of death for Black and brown children longer than that. But as far as 2020 goes, firearms are now the #1 cause of death for children in the United States. They surpassed motor vehicle deaths and those caused by other injuries and illnesses. And you can see on this chart the upward tick. This orange, I'll use my cursor, the orange line that shows that quite dramatic upward tick really starting in 2019, and that continues. Increasing firearm-related mortality reflects a much longer term trend and shows that we continue to fail to protect our youth from this preventable and predictable cause of death. American children face a substantial risk of exposure to injury, and death. And every day, every single day, 8 children die from unintentional shootings, often from unlocked weapons found in their own homes or a family member's home. I want to take a look at these numbers put together from the gun violence archive. Just look at what's happened now, only since the beginning of 2022. If you look on the right, my right, it should be your right also, the total number of gun violence deaths of all causes, and this is published, I just picked this up from August 14th, already 27,500, and we're just in August. If you look at the number of mass shootings just in 22, 411. The number of children already killed in 2022, 213, 473 injured. I mean, the numbers just pile up and pile up. We know that 2021 has been one of the deadliest years on records for deaths and injuries from gun violence. More guns were sold in this country between 2020 and 2021 than previous years. And as a result, once again, more unsecured and improperly stored weapons have been made available. School nurses are ideally positioned to work alongside others who are also committed to public health approaches to solve the issue of school firearm violence, but by both distinguishing the risk factors and then identifying actionable solutions that can be achieved with the support, of course, of funding. Thankfully, there's federal funding now available for research to really examine the root cause of the violence that translates into school shootings. So school nurses are healthcare partners embedded in school communities whose work remains steadfast and focused on prevention of injury and death from school violence and many other issues that happen in a school. We need efforts that champion the cause, sounding the alarm and creating the evidence-based, and it must be a multidisciplinary solution to advance the safety and security of all of our nation's children. These numbers are only part of the story. So this is the hard part of the story for me. Sometimes we get really overwhelmed with data, but it's important to share the data, of course. It's also important to connect data to stories. And nursing is very accustomed to using narrative as a very powerful tool. And so I'm going to share my personal why with you. I've already shared my professional why, but these 2 family members are my personal why I do the work I do in gun violence prevention. You see, 70 years stood between 2 mass shootings that changed my family forever. The first one was in 1949. That little boy on the left pointing his finger, that was my dad. He was only 12 years old on September 6, 1949, when he witnessed the murders of his mother, his father, and his grandmother, along with 10 other neighbors in what was considered to be the first mass murder in the United States. Ironically, Camden, New Jersey, the city where the murders occurred, is the city where I have served as a school nurse for more than 20 years. But the story continues unimaginably into further generations, because fast forward almost 70 years, and in 2018, my niece, Carly, was a senior at Marjorie Stoneman Douglas High School in Parkland, Florida. On February 14th, 2018, 17 students and staff were murdered by a former student. My niece survived, but she knew so many of the victims. So 1 family, 2 mass murders, 70 years, that's my why. And on that day, as my sister stood behind the yellow tape, we're all too familiar with the yellow police tape, waiting for my niece to be released from a closet that she was hiding in for more than 2 hours, I promised her and my sister and myself as a school nurse that I would do everything in my power as a public health person to help solve this unthinkable epidemic, really, the epidemic of firearm violence, especially when it comes to impacting our children. But there's one stunning metric that is often overlooked, and it's how many of our students have been exposed to gun violence just at school. This is a graphic put together by the Washington Post. John Woodrow Cox and his colleagues have been collecting this data, and they update it every so often. This was just updated on May 27th, right after the Uvalde school shooting. How many of our students have been exposed to gun violence since Columbine? More than 311,000 is the answer right now. The Washington Post has spent years tracking how many children have been exposed to gun violence during school hours since Columbine. Beyond the dead and the wounded, children who witness the violence or cower behind locked doors to hide from it can also be profoundly traumatized. There is not a standard data set that is being collected to determine school-based school shootings. So the Post pieced together its numbers from news articles, open source databases, law enforcement reports, and calls to schools and police departments. And while school shootings still remain rare, school shootings in 2020 and 2021 soared to the highest number in 2 decades, according to a new federal report that examines crime and safety in schools across the United States. The count now stands at more than 311,000 children at 310 schools. The Post found that at least 157 children, educators, and other people have been killed in assaults, and another 356 have been injured. While there's no comprehensive data on school violence at a national level for the current school year, school districts across the country are reporting an uptick in really concerning behaviors once school resumed in the midst of the pandemic. Fighting and violent incidences based on anecdotal reports. 60% of people working in schools, including educators and bus drivers, have experienced physical or verbal aggression from students and parents sometimes during the pandemic, according to a survey by the American Psychological Association. Additionally, there's been a significant increase in the number of students just showing up on campuses with guns. 249 incidences were reported in 2021, as compared to 112 in 2019. And then, although school shootings remain rare, active shooter drills happen in more than 90% of schools. Standard response protocols like school safety drills, fire drills, tornado, hurricane, earthquake drills, they've all been implemented as early as the First World War. But the critical difference between standard response protocols of the past is that technology now exists to implement today's active shooter drills with such realism that has the potential to induce intense and repeated trauma to its participants. During fire drills, hallways are not filled with smoke and debris to simulate a fire in order to force a timed escape response from students and staff. Tornado drills do not simulate wind and flying objects pumped into a building as classrooms of children flee. Yet these programs provide adequate preparation for students and staff during emergencies. Active shooter drills, the hyper-realistic kinds, are much different. It's so concerning that the American Academy of Pediatrics issued this policy statement. I'm just going to read a piece of it because it's very interesting. It says, participation of children and adolescents in live crisis drills and exercises. Children and adolescents should be included in exercises and drills to the extent that their involvement advances readiness to meet their unique needs in the event of a crisis, and or furthers their own preparedness or resiliency. However, there is also a need to be cautious about the potential psychological risks and other unintended consequences of directly involving children in live exercises and drills. These risks and consequences are especially a concern when children are deceived and led to believe that there is an actual attack and not a drill, and or for the high intensity active shooter drills. High intensity active shooter drills may involve the use of real weapons, gunfire or blanks, theatrical makeup to give a realistic image of blood or gunshot wounds, predatory and aggressive acting by the individual posing as the shooter, or other means to simulate an actual attack, even when participants are aware that this is a drill. This policy statement from the American Academy of Pediatrics outlines some of the considerations regarding the prevalent practice of live active shooter drills in schools, including the recommendation to eliminate children's involvement in high-intensity drills and exercises, with the possible exception of adolescent volunteers, prohibit deception in drills and exercises, and ensure appropriate accommodations during drills and exercises based on children's unique vulnerabilities. Interestingly enough, some of our students think that the US Capitol attack looked a lot like an active shooter drill or an actual school shooting, and they certainly took notice. Images of members of Congress hiding and sheltering in place during the US Capitol attack made many American students think of their own survival training during school shooting drills. Generation Zers, also called Generation Lockdown, hope this traumatic experience leads lawmakers to think more carefully about gun reform, and they actually have to some extent. One student, as her teacher reported, said, "I don't feel sorry for Congress at all." "Oh, I'm sorry. Did you have to hide under your desk because of guns? I've had to do that 6 times since kindergarten. School is terrifying. Maybe now they'll pass gun reform." This is what a teacher noted that her student told her. These are my kids. Aren't they adorable? Little preschoolers in my city of Camden, New Jersey. But you know what? One day I was working in my health office when the loudspeaker came on. But this time it was not the voice of the director. It was the sound of gunshots. I froze, my heart sunk. I had no students in my office, so I locked the door. I covered the glass. I did all the things I was supposed to do. I closed the blinds. I hid in the corner. I had no idea that it was an unannounced lockdown, or was it an active shooter in our building? I did not know. I waited alone and isolated, feeling completely helpless, very traumatized, but thinking about my students, scared, maybe injured, vulnerable, was horrifying. In the end, I found out that it was a drill. An unannounced active shooter drill. The person running the drill used an app on their phone that sounded like gunshots. Remember, these are preschoolers, which she played over the loudspeaker. Even now, just telling you, I have, my heart is racing. I still get angry when I think about that day, and I try to do everything in my power to stop hyper-realistic active shooter drills. They are not helpful. They are not evidence-based. They do not make our school safer. Speaking of not making our school safer, these are just a few headlines from this past week. In Ohio, this was a New York Times article, trained, armed, and ready to teach kindergarten. More school employees are carrying guns to defend against school shootings. In Ohio, a contentious new law requires no more than 24 hours of training. I would never want to be a school nurse in that district. Here's another one. North Carolina, a school district near Asheville is planning to put an AR-15 in every school safe in their office in the event of another school shooting. That is not school safety. On a happier note, the Brookings Institute just released this really excellent report addressing the root causes of gun violence with the American Rescue Plan funds. And I did include a link. It's a really comprehensive, excellent article that I thought would be helpful. So what can we do? What can school nurses do? What can you do as healthcare providers, as parents, as community members, as people who care about what's happening at school? Let's make sure that school safety plans developed across the country address the need for safe, nurturing schools that offer physical protection from guns, as well as close connections and supportive relationships between staff and students. You see, we need healing-centered environments. We don't need to make our schools feel more sanitized and prison-like than they already do. Can we change the language from threat assessment to a wellness check if there are concerns about a student's behavior? Can we eliminate zero tolerance discipline policies to focus on understanding children's experiences rather than punishing their behaviors, but still carefully monitoring and responding to the impact of these reforms to ensure that they benefit all students across racial, ethnic, and income lines? Can we minimize the threat of gang violence and mass shootings in children's neighborhoods and schools by restricting gun access for children and teens under 21 and other high-risk groups, implementing universal background checks, banning assault weapons, high-capacity magazines, and bump stocks through common sense safety laws? And again, I said, what if we change the language from a law enforcement centered to student centered? No More Empty Desks on the bottom left is an art installation project that I started to give voice to my Camden City students who experience, unfortunately, community gun violence on a regular basis. And using a public harm reduction model, much like syringes and condoms made available without questioning, but offering education, can we also provide gun safety storage, equipment, and education at back to school night? I've done it many times at my school. We need to create a safety net for students, which schools are positioned to do. We need it more than ever because of COVID. But even before the pandemic, you know, school safety was tenuous at best. Over here on the right-hand side, that amygdala reset station, teachers are actually creating spaces within their own classrooms to help children learn how to self-regulate or co-regulate with them. And that has proven to be very successful. But I do want to finish with a story. This is a message that I got very late one night. It was a Twitter message from someone that I'd never met in person, but she knew that I was a school nurse and she knew that I worked in the gun violence prevention arena, especially in the public health model. And this was her message. She said, "Robin, I only have one child left. What should we do about school?" This message came from a Sandy Hook mom. She had 2 children at Sandy Hook Elementary School. Her daughter was 6. Her son was 8. Her daughter died at Sandy Hook. Her son, then 8, now 15 going on 16. This was when COVID first started. When COVID first started, and she was trying to determine whether or not to return him to school. She reached out to me, a school nurse that she did not know, but she knew that I cared about gun violence and that I was active on social media, especially regarding school safety. And this is the question she asked me. And it made me realize I was trying to put all the pieces together of gun violence and COVID and school safety. And this one message made me realize that the bigger overarching picture here is that we don't feel safe. We need to feel safe in our schools and our homes and our communities. And so, you know, we have these opportunities to have moments with people. And this was one of those moments. And I told the mom, we've since met, we've since become really good friends, but I told her that if my school nursing career would have ended with her message, then I would have done everything that I could in my career to make a difference, because I was so honored that she reached out to me, knowing that I was a school nurse. I looked over her son's return to school plan. We talked about it extensively. He did return to school successfully. But we need to be there for each other. We need to reach out and create these connected communities. So I thank you for this quick lunchtime meeting, and I hope that my message resonated with you. So I'm going to stop sharing, and maybe there's a few questions.
Thanks so much, Robin. That was a great presentation, and it just sounds like you're doing amazing work. We're all so grateful to have school nurses like you out there.
Oh, thank you.
Before we go to the Q&A, and if you have questions, don't forget to put them in the Q&A. We have a quick closing poll for everybody. And then don't forget to look out for a follow-up email that will have information about the next webinar for September, and with a link to this webinar's recording so that you can watch it later and share it. And now we have a couple questions from the Q&A for you, Robin, if that's okay. And
Sure.
the first one is, are you aware of efforts to encourage students to report concerns about other students to school officials, like gatekeeper trainings? And do you think these types of programs will help identify students at risk of suicide, violence, and mass shootings?
So I think that is a fantastic question. And I am not familiar with the Gatekeeper program, but I am familiar with some other anonymous reporting programs. The one that I really do like the best uses a trauma-informed approach, and it's called Help Me. It's a Help Me app platform, and it includes social and emotional learning. It includes addressing social determinants of help. It's really a phenomenal tool that I am desperately trying to bring to my school district. It's called Help Me. You can find it through, I can put it in the chat if that would be helpful.
Yeah, that would be cool. I would love to check that out.
Yeah.
And do you have a sense of how those programs mitigate the risk of stigmatizing Black and Brown or historically over-disciplined students, or stigmatizing peers, or being abused in a way to, like, target certain kids?
Well, and that's why we need to get away from the language that does stigmatize kids, like calling them threats. That's why I brought that up in my talk. Here's the Help Me app. I'm such a big, and there's also funding for this Help Me app. If anyone wants to get in touch with me, I can certainly help you link to someone in this organization, because there's really interesting funding through the Department of Justice for this. Oh, there you go. It says for host and panelists. Can you share that out?
Yes, I
Okay,
think that
great.
I have that power. Let me
Because
check.
that is a huge issue. I did not address that in my talk, so thank you for bringing that up. We need to move away from those stigmatizing, accusatory messaging, and think about healing-centered, inclusive messaging that is trauma-informed, and I do believe that changing the focus from using I mean, let's face it, the threat assessment is because of, from Homeland Security, it's because of through that Secret Service, what they use for threats. Our children aren't threats. Our children are children. We need to be able to protect them. I mean, even the Parkland shooter, if you look back through his history, there were so many times that they could have intervened, and they kept pushing it to the next grade till finally, and believe me, I am not condoning anything. He had access to a weapon. He was so, he fits this very unfortunate pattern of a child who you could have predicted that he was going to do something. Why do we wait for it to get there? We need to be responsive, but we need to be responsive in a way that is not further damaging.
Yeah, and that is he's another one of those stories where people did predict, it's really sad.
How many? I mean, the data on how many people know that somebody's going to do something ahead of time is shocking. Listen, even the killer of my father's family, everybody knew that he was troubled. Everybody knew he had weapons. There was, we do this Monday morning quarterbacking. It doesn't mean anything because we take no action the next day, but yet we can prevent these things.
We have one more question, which is, when you provided education and information about safe storage and other topics at back to school notes, how did parents respond, and how did that go over?
So, I like to take some risks. I think it's important. I know that parents don't necessarily want to be asked some probing personal questions, but I really do feel that it's important to provide the education and the equipment, because very tiny studies that we've had show that that's most effective. It's not just the education. You have to provide the equipment. And you know what? I didn't have a big discussion about it. I had it available and accessible, just like I'd have condoms, just like I've had anything else that you'd fall under the harm reduction model. And parents took them. I mean, Moms Demand Action, they will come if the school nurse or someone in school doesn't want to do it. Moms Demand Action will come with gun locks to your back to school nights. You just have to ask. There's so many resources
cool.
out there.
Well, thank you so much, Robin, for sharing all this. And it was wonderful to have you. And thanks everyone else for coming. And don't forget to look for an email with the recording and more information for the future.
Terrific. Thank you.
This was really great. Thanks. Bye-bye.
Bye.